Karen, thank you so much for a wonderful talk. We're going to do what we did this morning in the session and save the questions to the end and have the panel come back and have a discussion at that point. So I'll go ahead and introduce our next speaker, Kevin Grove, who has 2 jobs these days. I don't know how he had time to come and see us. He's a senior scientist in the Division of Diabetes, Obesity, and Metabolism, and the Division of Reproductive and Developmental Science at the Oregon Health Sciences University, where it's been for some time. He's now also the Vice President of Obesity Research at Novo Nordisk in Seattle. Dr. Grove is well known for developing an internationally recognized research program that focuses on how poor pregnancy, health, and nutrition programs have an impact on offspring, particularly with respect to high-risk metabolic and psychiatric diseases. He's going to be talking to us about maternal health and diet effect on offspring metabolic functioning.
Thank you, Leanne. Also, thanks to the organizers for the invite. It's nice to be able to participate in this very, very important discussion that I've spent the last 20 years of my career at. But I also want to recognize Jed Friedman, who's been my partner in this. That's a weird way to put that, but he has been for a very long time. And I'm very thankful that Jed has really taken the lead now that I'm stepping back from being a day-to-day participant in these studies. But I also want to say that I'm going to focus most of my efforts today talking about the work of Eleanor Sullivan and Antonio Frias, who have been in my group for quite a time. Eleanor is an investigator at the University of Portland, but also at OHSU, and she focuses on brain and behavior development, while Antonio is actually the director of the high-risk pregnancy clinic at OHSU and focuses on placental function. And I actually consider these 2 of the most important areas and outcomes that our research has generated. And that's saying a lot, also pointing out the fact that my particular interest and focus is not up there. So I'm glad that I've been taken over by 2 talented investigators that are really pointing out the important areas that we're discussing. I don't need to repeat all of this about the importance of maternal obesity and what the outcomes are. Really, I think the value that our group has added is really using the non-human primate to try and model and understand the different aspects of it. So this is a relevant model with direct human translation, not to belittle the rodent studies, because we do a lot of that ourselves, but we're actually interested in the very broad spectrum, the uncontrolled components that you get in human studies, but yet we can control some of those outcomes. So we can understand better about the contribution of nutrition or different types of nutrition, as well as really doing extensive phenotypes. I won't get really in depth in it, but to try and highlight a few key aspects from these studies. I'm going to talk a little bit about the model just briefly. Jed's introduced it. That was very helpful. But try and focus on the complications, the consequences, and then touch a little bit on what the heck we can do about this problem and how we think that we can use this model for it. So the model is very simple. We have 2 main types of adult Japanese macaques. We either feed them a healthy diet or we feed them a high-fat Western-style diet. So it's high in carbs as well. It's a very broad diet. And we just let them go for several years, and we breed, and we can actually look at SIBs, and we can actually look at them as they progress through the different metabolic complications. The value of it here, and I must say when I first started this study with Jed many years ago, the initial response was, is everything so bloody variable, we're never going to be able to figure out anything. Well, that's the human nature of things. And so that's actually what I like about these studies, is that we're able to look at the phenotypes by their diet, but also by the distribution of their metabolic outcomes, whether it's increased body weight, adiposity, insulin sensitivity, insulin levels, triglycerides. We can measure many of these things and then do correlation analysis. And this is actually just a subset of the animal. So we've been doing this for a long time, so we have a lot of outcomes we can measure. And today I am going to focus on the placental function, inflammation, and some of the metabolic consequences, but then also touch on the important brain and development outcomes. So within regards to the placenta, and Jed touched on this, we actually think this is some of the most important component to understanding why we have these complications, and especially when you start looking at the complications versus undernutrition, malnutrition, and obesity and high-fat diets. And we think that it has really an initiation in the placenta itself. And there's a lot of clinical data demonstrating that various clinical conditions, anything that results in hyperinsulinemia or hyperglycemia, such as gestational diabetes, causes complications in the placentas, including in humans. And that's been well characterized by several groups. But then we can actually take a step back and say, well, why then, what about the diet itself? What about the diet that suggests that we would have complications in the placenta? Well, actually, my background is actually somewhat in cardiovascular disease, and we studied the effects of lipids in cardiovascular disease all the time, and the placenta is just a large vascular organ. So it's really not surprised that lipids that are known to cause inflammation and vascular dysfunction could have a direct impact on placental function. And this was elegantly demonstrated by Antonio using traditional Doppler ultrasound techniques. And what he was able to do is just show that through measurement of placental blood flow during the early third trimester, and that's again the value of these studies, is that we're studying the impact while these things should be normally function. So he was able to demonstrate, irregardless of whether or not the mom was obese, the high-fat sensitive group, or whether or not the mom was lean, but eating that high-fat diet, that there were reductions in placental blood flow. So that was sufficient to cause reductions or placental insufficiency, and actually placental insufficiency to a level that experimentally, if you induce this level of placental insufficiency, it causes negative outcomes. So just being on the diet was a problem. But he actually extended these studies to look even some of the histological, and this is a picture of a healthy placenta, and then this is a picture of the placenta from a high-fat diet sensitive mom, and he was able to characterize infarctions as well as calcifications, which were signs of actually preeclampsia. And these were actually analysis done by a blinded pathologist. And they actually thought that these were coming from preeclamptic patients. So that's pretty scary in the fact that this is just simply animals that are overweight or obese and on a high-fat diet. But I will say that there is an interaction. So we do see a functional abnormalities by the diet alone, but it is certainly exacerbated with obesity or insulin resistance and high triglyceridemia. But this leaves us in a conundrum of not really knowing what we can do about it. And so Antonio is trying to design some new diagnostics, and he's just at the beginning of it, because when you look at Doppler ultrasound, you're really measuring the overall average outcome of the placenta. This is a monkey placenta, and they're bimodal. Most monkeys are bimodal, and they have a small percentage of single lobe, where humans are the opposite. Most are single lobe, and you get a few bimodal. But if you start taking blind samplings from this placenta to try and figure out molecularly what's going wrong, you actually, from a very dysfunctional placenta, can find areas that look rather normal. And you can find areas that look rather abnormal. So that becomes a challenge. Rather than just grinding up this whole tissue and really looking at the average, we wanted to do something more. And so he's designed these studies to look using contrast-enhanced MRI, and he can actually do this at several stages during pregnancy and actually identify down to the cotyledon. And in fact, he can even image individual spiral arteries and look for areas of abnormalities. We can also add other contrast agents that identify inflammation. We can identify nutrient transfer, all on a very, very nice architectural organization. And this is actually just looking at blood flow in different cotyledons in this non-human primate model. And you can see that there's quite a bit of variability. And at least preliminarily, what he is finding is that actually what you do is you see very localized damage. So you get some areas that are normal and some that are abnormal, but now we can start utilizing this to at least experimentally. Whether or not you could use it clinically, that would be hard unless you had a really high-risk patient. But at least we can now start correlating something with biomarkers that may inform us clinically. But experimentally, this will be really important outcomes. So to summarize Antonio's data, and it's really sad to say that you can summarize 5 or 6 years worth of data all in one graph, but that's what he's done. Essentially, we know that just increasing the dietary lipids by itself can cause a problem, and then you increase by adding on other hits, such as obesity and hypertriglyceridemia. You can actually change the maternal environment causing the obesity, but you also change these nutrients, saturated fatty acids. We've actually observed, even though the diets were normalized for omega-3 fatty acids, that they are actually low, and you change this important ratio of N6 to N3 fatty acids. And that's actually transmitted over to the fetus. And that's really important because N3 fatty acids are really important for development, especially brain development. But within the placenta itself, interestingly enough, we characterize that there's an increase in cytokine productions in the placenta, and these are actually specifically shunted into the developing fetus. So we were actually not able to measure these increase in cytokines in the moms, only in the fetuses. And we know from other experimental models that if you increase inflammatory cytokines during development, you cause a whole host of problems. So there we've already identified something that we can start to tackle is maybe fetal systemic inflammation. And these can all obviously cause all sorts of complications downstream, including pregnancy complications, but obviously developmental malprogramming. And this is getting back to this idea that it may all start with the placenta, or at least we may be able to identify the placenta, because all of these conditions here, whether it's maternal obesity, maternal weight gain, pregnancy weight gain, gestational diabetes, preeclampsia, but also all of these maternal nutrient manipulations, they've all been shown to be linked to placental dysfunction in some course. So that clinically, that allows us to focus on something that we may want to be able to improve down the line that may very immediately have improved clinical outcomes. Jed's already touched on this. I'm not going to focus too much on the metabolic outcomes because, well, they're important, but Jed's already briefly talked about the increased liver triglycerides. We've got hepatic insulin resistance in the offspring, muscle insulin resistance in the offspring, decreased alpha cell mass from the pancreas, and also cardiac hypertrophy. These are all signs in very young animals of very complex metabolic complications. And the issue here is it's one thing to develop that when you're 35, 45. It's another thing to hit the ground in that status and have to experience that throughout your life. And Jed's already demonstrated that while we can do some nutritional manipulations and improve some of these metabolic outcomes, that some of the underlying molecular changes are still there. Whether or not that's all epigenetic, we don't know. So now I'm going to focus on some of the more complex behaviors, and we have this very complex model. These are the offspring, so they're either born to moms on this healthy diet, and then they're kept with them during the postnatal period. I guess this thing's automatically advancing here. And then, obviously, they can be maintained on a controlled diet after weaning, and that's your sort of typical ultra-healthy all the way through controls. And this is actually typically what happens is you get this high-fat environment, and they maintained on the high-fat throughout. And we know that that's bad. Anybody here thinks that that's going to give us a good outcome? Yeah. But we can also do these manipulations. I'm sorry, for some reason this thing's advancing through. You can put the control babies on a high-fat diet post-weaning, or take the high-fat diet babies and put them on a controlled diet post-weaning, and we consider this a dietary intervention. And for today's talk, I'm just going to focus on these two groups here, because the babies are maintained on this healthy diet for long periods of time, and then we can look at the outcomes that are just due to the maternal and the early postnatal environment. So immediately, I can tell you, I'm not going to show you the data today, but you get this long-term persistent inflammation in the brain. That's not surprising. If you have cytokines being produced by the placenta, they cause brain inflammation, and that seems to be sustained. And that's not a good thing. But we also get this persistent neurochemical imbalance. So again, these are babies that are being maintained on this diet out to 1 year of age, and we've actually have some data longer now. And what they show with is a decrease in serotonin levels. And this is, again, independent of whether or not the mom is fat or skinny. They have low serotonin levels. They have low dopamine levels, which is important for hedonic feeding. And they also have have abnormalities in the melanocortin system, which is an appetite regulating system, as well as a stress regulating system. So these are things that are permanently altered, even though the baby's been put onto this healthy diet. But they also have long-term abnormalities in brain connectivity in cortical regions. And this is data from Eleanor and her collaborators at our Advanced Imaging Institute. And shown here in pink is actually in the frontal cortex, decreases in functional connectivity from the midbrain to the frontal cortex. But yet in the temporal cortex, over here, we actually get an increase in functional connectivity. Now that by itself doesn't really help us out other than to say that we have long-term differences in brain function. And it also raises that these are important behavioral centers and whether or not that highlights some abnormalities in behavior. So I'm going to talk a little bit about some of these metabolic complications and behaviors, stress behavior and social behavior, and not really much on the cognitive function. So metabolically, what happens just quickly? Interestingly enough, if we put these animals on a healthy diet after weaning, their body weight's actually normalized. They look fairly normal, even though Jed's already shown you that their liver enzyme, or some of their liver molecular signals are abnormal. But when we put them back onto a high-fat diet at 1 year of age, they have accelerated weight gain. And this accelerated weight gain is actually due to an increase in overall food intake during that time. But ultimately, the healthy babies do come up to the same weight. And really the question is long-term what happens on this. So it really appears to be this acute increase. But they also have almost binge-like eating episodes when you give them very palatable diets. So if you give them something novel, access to it, they will actually lever pull all day long and stuff their cheek pouches and their armpits full of these sweet treats, and then they go off into the corner. And I myself do that after I've had a grant review and I'm looking for some relief, but yeah, that's a different issue that me and my psychologist is working on. But that points towards some drive for palatable foods that they are no longer getting. And we actually didn't see a change in food preferences in the control animals under those conditions. This is metabolic rate, and this is really complicated, and we got really confused, so I'm going to show it to you. These are the healthy animals, pre and post high-fat diet, and so they have a high metabolism during the day, active period, and then low metabolism at night. Actually, the high-fat babies have high metabolism during the day, and this seems great, and that's probably why their body weights are not different, but I think it's probably a manifestation of the fact that they're anxious and they have a hyperactivity and they spend a lot of time avoiding social contacts, and I'll show you a little bit about that. But they also have abnormal, they have a normal, this is a fuel utilization, so in the day you use carbohydrates and then you go to night using fats. They have an abnormal shift in their metabolic fuel utilization that we don't understand. I'm not going to spend time on it, but just saying that they're not normal metabolically, we just don't know what it means. This is Eleanor's famous Mr. Potato Head study. This is males shown in blue circles and females shown in triangles. We actually saw a dramatic increase of anxiety behavior. This is a latency to interact with these toys. but also understand that it's highly variable. So it's a risk factor. It doesn't mean that you're going to have anxiety disorders, but it's a risk factor. Males, on the other hand, have a tendency to lash out more. They have more aggressive behaviors. So this is a sex-dependent difference, but the underlying cause is probably the same. And both males and females have an increase in cortisol levels, suggesting that, again, it's the same issue, but just different utilizations. When we do social behaviors, we have increases in shrieks when doing novel peer interactions. This is not sex-dependent. And they also do less initiation of contacts, successful contacts, but they receive more. So essentially, they come in when you put them into novel peer, they turn around, and the other peer can engage in them, but they don't do much to engage that novel peer themselves. They like to spend more time alone, and they spend almost no time in social play. And this was irregardless of whether the moms were fat or skinny, and whether or not it was male or females. So what is the causes of this? Well, we really have evidence of pretty much all of these things likely being a component of it. I've already shown you this here, that liver triglycerides are not, increases in liver triglycerides, at least in the fetus, is not dependent on maternal obesity. This is maternal behaviors, and we actually know that obese mothers have decreases in or increases in anxiety behaviors, and being on the high-fat diet can cause that as well. So maternal behavior may also be impacting this. And so again, this just highlights, even in the clinical data, that there's lots of evidence that both of these components are involved. I'm going to end with this right here, but what do we do for interventions? And, weight loss during or prior to pregnancy is certainly optimal. Weight loss during pregnancy is typically to be avoided. And we'd like to improve diet and exercise, and we know that that can play a role. The question is pharmacotherapies or surgery? And this is actually some evidence here. Bernadette Grayson, a previous graduate student of mine, did this in rats. And she showed that she could get improvements in outcomes by doing bariatric surgery in the rat prior to pregnancy, but then there were some longer-term complications. But also several groups using bariatric surgery in women. The initial studies demonstrated that if they underwent bariatric surgery, there was dramatic improvements or reductions in pregnancy complications, and that there was a dramatic decrease in macrosomia. And so that was really, that caused a firestorm. But actually now the more recent studies have shown that there's a dramatic increase in preterm births and small for gestational age babies. So I want to just point this out because it's really important for us to understand that these things need to be tested before we really go into it. And that includes whether or not it's pharmacotherapy or not. And I'm not going to go into resveratrol treatment, which we did. Obviously, the question is what do we do afterwards for the children? And, this can, you don't want to get into surgery. You don't want to get into pharmacotherapy. Can exercise, what has been used in rodent models, can that do it? That may be so. Can we improve some of the social issues with more enriched environments? I think those things have to be tested. But I know, we've got experts in this crowd that know that there are some abnormalities that need to be dealt with, and we have to figure out what the strategies are for doing that. And I'm just going to end this, remind people this is a vicious cycle, and thank the people and the funding sources. Thank you.